Welcome to This Explainer. Today, we're doing a deep dive into the fascinating world of human aging and modern geriatric care. We're going to completely unpack how we understand, evaluate, and actually care for older adults. I promise you, by the end of this, you're going to look at getting older in a completely different light. Let's jump right in.
So right off the bat, we have to ask ourselves, is aging just another disease? It's a super provocative question, right? We kind of have this habit of blurring the lines between just getting older and actually being sick. But are they really the same thing? Well, as we're going to see, treating aging like an illness isn't just factually wrong, it literally stops us from giving people the care they actually need.
And just to put the sheer scale of this into perspective, 19%. By the year 2050, India's elderly population alone is projected to hit 19%. That is enough to fill countless cities. We're talking about hundreds of millions of people shifting into their senior years. This is a massive societal shift. It makes understanding geriatric care absolutely crucial for all of us, whether you're a healthcare worker taking care of a parent or just, planning for your own future.
Okay, let's go ahead and bust some myths right out of the gate. There's this super persistent, kind of sad misconception that depression and loneliness are just standard features of getting old. But the reality? Growing older actually brings incredible emotional benefits and a lifetime of shared memories. Feeling chronically sad or lonely is a treatable medical condition. It's not just part of aging. If an older adult is depressed, they need real care, not just a sympathetic shrug.
And then there's this idea that cognitive decline comes for everyone. The whole you can't teach an old dog new tricks thing. No way. That is totally false. Sure, walking into a room and completely forgetting why you're there, we all do that. It's a completely normal human experience. But true dementia, that is a specific disease. Older adults can absolutely build new memories, pick up new skills, and thrive intellectually well into their later years.
Now, here's a myth that actually causes a ton of physical harm. We love to tell older relatives to just take it easy, right? We don't want them getting hurt. But honestly, the armchair is not their friend. Sitting around leads to a really rapid loss of independence. For seniors, a sedentary lifestyle strips away their ability to do things for themselves way faster than safely exercising ever would. Literally, sitting is far more dangerous than moving.
So why is moving around so crucial? Well, it all comes down to a concept the World Health Organization calls intrinsic capacity. Think of it as the grand total of a person's physical and psychological capabilities. This is huge because chronological age is actually a terrible marker of health. You can have an 80-year-old running marathons with the intrinsic capacity of a 20-year-old, alongside a 60-year-old who needs full-time care. It's all about the capacity they manage to hold on to.
Now, I'm not saying the body doesn't change. It absolutely does. Blood vessels and lungs lose a bit of that youthful bounce, reaction times slow down, and your sleep patterns get a little weird. But notice the distinction here. These aren't diseases. They're just natural, physiological wear and tear. It just means that the body is setting the stage, making older adults slightly more vulnerable to specific clinical issues down the road.
So, if we take a step back, here's the absolute fundamental difference. Aging, it's inevitable, it's progressive, and it's irreversible. But disease is based on vulnerability. It's often preventable, usually treatable, and has specific causes. We can't ever mistake pure aging for a disease. You wouldn't call a slowed reaction time dementia. And on the flip side, we can't write off a treatable illness as just old age.
And that brings us to what's honestly the biggest hurdle in geriatric medicine, the iceberg phenomenon. In younger folks, what you see is usually what you get. But with older adults, a presenting complaint, like a sudden fall, is almost always just the tip of the iceberg. Hidden just below the surface could be a whole messy web of underlying conditions. A silent urinary tract infection causing confusion, or maybe undiagnosed heart failure making them dizzy.
Because of that massive hidden iceberg, diagnosing the elderly is literally high-level detective work. You're constantly looking for the weakest link. Think of it like your car's check engine light. A mild infection might attack a previously injured organ first, causing a weak arm from an old stroke to flare up. You're dealing with missing symptoms, atypical presentations. A heart attack might completely skip the chest pain and just show up as sudden confusion. The traditional medical rulebook? Yeah, you basically throw that out the window. So how on earth do doctors solve this mystery? They use something called a comprehensive geriatric assessment, or CGA. And trust me, this isn't your standard 15-minute pop-in checkup. It's an intense, multi-dimensional deep dive that looks way beneath the waterline of that iceberg. It maps out everything: medical, psychosocial, functional capabilities.
The goal here is to craft a long-term care plan that keeps them independent for as long as possible. But, healthcare systems are swamped. Not everyone gets this massive deep dive. So doctors look for blaring red flags. If someone is over 75, if they suddenly need help getting dressed, if they live totally alone or have a history of falls, these are loud warning sirens. They tell doctors, hey, this person is super vulnerable and urgently needs that full holistic evaluation right now. When you put this into practice out in the real world, it builds this incredible, seamless safety net. It starts right at the community level with frontline workers doing basic checklists. In the literal second a red flag pops up, the patient gets escalated. They go from a preliminary check up to a community health officer, all the way to a specialized doctor for that deep clinical dive. The whole system is literally engineered to catch those hidden iceberg issues before they become disasters. All right, let's step back from the clinical data for a second. At the end of the day, comprehensive care is a deeply human team effort, and family is at the center of it. With older patients, the finish line isn't always about curing a disease. Most of the time, it's about preserving comfort, keeping them independent, and keeping their minds sharp. The best care plans are built entirely around the patient's personal values, not just what a lab result says. Honestly, treating the elderly requires a really profound level of empathy. We're shifting away from just saying, here, take these pills, to actively managing their whole environment and their social support systems. When an older adult walks into a clinic, they shouldn't just be handed a prescription. They need holistic, compassionate care that treats them as a whole person going through a highly sensitive phase of life. It really all boils down to this incredibly powerful idea. Long-term care is about more than meeting basic needs. It is about preserving older persons' rights and human dignity. That is the heart and soul of geriatric care. It's not just about adding years to life. It's about fiercely protecting the fundamental freedoms, the comfort, and the dignity of the people who paved the way for us. Which brings us to the end of this explainer. But before we go, I want to leave you with one final thought to mull over. How do you view the older adults in your own life? Are you looking at their age as a disease? Or are you seeing their actual intrinsic capacity? Are you assuming they can't learn, or are you cheering them on to thrive? I really hope this leaves you excited to approach elderly care with a completely fresh perspective. Thanks for joining me today.